Could you explain us what you believe the reasons are for the increasing lack of confidence, or in other words, hesitancy in Europe?
Well, in our vaccine confidence research, and particularly using our vaccine confidence index, which we've run globally, but also have been commissioned by the European Commission to repeat, we did in 2018 and will be doing again in 2 years. What we are finding as we look more into it, it's quite a mix of issues. But I would say if there's number one thing that's come up, and this has been consistent with research we've done also with ECDC, is safety. And it's safety, safety, safety. And sometimes it's guised in other things, concerns about aluminum, heavy metals, toxicity, but safety is a real concern. And I think that's one of the reasons the advanced initiative is absolutely important. I started the morning on BBC with an interview with a woman whose child had been damaged by measles, actually disabled from measles, and one who's refusing the vaccine because she's concerned that there's, in her perception, absolutely no safety record. Now, where did we fail in people like the mother who was refusing vaccines because she felt like there was no, and she even used the word, robust safety? So I think we've got a lot to do in terms of communicating better safety, and when there are events that come up, that we follow them and keep people aware of how they're evolving. There's also some ideological reasons, not just religious, but naturopathy, homeopathy. There's quite a movement globally in different, sometimes with traditional medicine, like in India, to the natural living as an identity. We see it very much that people who want a natural birth at home are kind of organic food, sometimes gluten-free, or also want a vaccine-free child, their children vaccine-free, and some even saying they're, no more contraceptives, they'll go back to rhythm. This is not a fringe. This is a growing movement, and within that comes the vaccine-free. So some of that is because of different aspects of vaccines that are basically safety concerns.
Dr. Retzai, you recently wrote a very nice commentary in the British Medical Journal on the issues about vaccine hesitancy in Italy, which is quite high, and the mandatory vaccine policy that has been installed. You stated, and I quote from that article, "Vaccine mandates have become increasingly politicized in Italy, but policy must be guided by evidence." Our first question is, could you explain us briefly what the main issues are for vaccine hesitancy in Italy? Why is it so high?
Yeah, actually we did a survey a couple of years ago showing that less than 1% of school children parents are really anti-vax, but about 15 to 16% are just hesitant. We also investigated the determinants of hesitancy, and we realized that the main determinants were not having received from pediatricians recommendations to fully vaccinate children. Second, having received discordant opinions from pediatricians. So pediatricians are very important in giving the right information to the parents. But also another problem was using non-traditional medical treatments that were associated with hesitancy, in particular the use of homeopathy. And then there were parents reporting that they met parents of other children that experienced severe adverse reactions. This is very difficult to confirm, and we don't know why actually. A rather large proportion of the parents answered giving this information that is not, to our opinion, reliable. So I think that there's a lot of work to do, especially with family doctors and family pediatrician, in order to increase and to improve the information that is given to school children and parents in order to improve vaccination coverage.
Thank you. Do you think that having rapid and reliable evidence on the benefits and also the risks of vaccines could help, and how?
Yes, I think that even though mandatory legislation may accelerate and increase the vaccination coverage, it's very important to improve and to increase the knowledge of the people, what we call health literacy, that in Italy is not very high, at least it's suboptimal. So it's very important for family doctors and pediatricians to give information, the right information to school children, parents, and to spend some of their time to give the right information, not only on the efficacy and effectiveness of vaccines, but also on possible side effects and adverse reactions, because it's much better to increase the knowledge of the parents rather than having just a mandatory legislation. Mandatory legislation may help, but then it has to be supported by increased levels of information to keep high vaccination coverage levels.
Thank you.
Could you please tell us how the availability of the vaccine safety data link has helped the US in communicating with healthcare professionals and parents and address safety concerns?
VSD has been instrumental in providing timely monitoring of new vaccines and addressing a number of vaccine safety concerns. VSD generates rapid, important safety assessments for both routine vaccinations and emergency vaccination campaigns. VSD monitors safety of seasonal influenza vaccines in near real time, and it provided essential information on the safety of influenza A H1N1 monovalent vaccine during the 2009 pandemic. VSD investigators have published important studies on numerous vaccine safety questions, such as demonstrating that childhood vaccines are not associated with autism or other neurodevelopmental disabilities, the safety of human papillomavirus vaccine, and maternal vaccine safety, just to name a few. VSD prioritizes evaluation of new vaccines, searches for possible unusual health events after vaccination, monitors vaccine safety in pregnant women, and has pioneered development of biostatistical research methods. I believe that the existence of a robust vaccine safety monitoring system, such as provided by VSD, along with the VAERS system, is vitally important in maintaining public confidence in vaccines by providing reassurance that the safety of vaccines is being continuously and closely monitored so that potential problems can be detected and dealt with swiftly.
How do you think that the system set up in advance may help Europe?
Since at least the 1970s, immunization programs have been challenged by periodic vaccine safety scares that have led to decreased acceptance of vaccines and resurgence of vaccine-preventable diseases. Europe may be going through such an episode now, with decreased confidence in MMR vaccine and resurgence of measles in some European countries. Being able to answer in a timely manner whether or not a particular vaccine actually causes a specific adverse event has become increasingly important. In addition, although pre-licensure trials are usually adequately powered to evaluate vaccine efficacy under highly standardized conditions, evaluation of vaccine effectiveness is often necessary post-licensure to assess the benefits of vaccination in real-world settings. The ADVANCE project has demonstrated in Europe that computerization of healthcare services data, including immunizations and medical visit diagnoses, allows the creation of a large distributed database network to meet the needs for post-licensure monitoring of vaccine safety, effectiveness, and risk-benefit assessment.
Hello, Dr. Arlets. The European Council recommendations of December 2018 state that the European Medicines Agency and ECDC should support continuous monitoring of the benefits and risk of vaccines and vaccinations at an EU level, including through post-marketing surveillance studies and developing methodologies and strengthening capacities to assess the effectiveness of vaccines and their vaccination programs. My first question is, given these recommendations, how do you think that the advanced VAC4U network system and tools could be utilized to fulfill these recommendations?
The European Medicines Agency plays an important role in the authorization and benefit risk management of vaccines in the EU. Because of these responsibilities, EMA has actively supported the ADVANCE project from its inception. ADVANCE has delivered important tools for European public health, including ways of monitoring the use of vaccines, methods to conduct studies of benefits and risks of vaccines, and importantly, a way for stakeholders to collaborate so those who can contribute expertise are able to do so. On behalf of the EMA, I'd like to congratulate the ADVANCE Consortium and wish all the collaborators and stakeholders success with the next phase, ensuring that the project outputs are transformed into a sustainable system for vaccine benefit risk monitoring. In this way, we can contribute to vaccine monitoring, have robust evidence upon which to take decisions on vaccines, and contribute to the health of EU citizens.
What is the biggest challenge you face in fulfilling the post-marketing benefit risk monitoring requirements for the vaccines?
So our biggest challenge is trust. The trust between public and private researchers in vaccine collaboration, and the trust between the general public and vaccines researchers and manufacturers. Trust can be built by setting up a transparent framework to monitor the benefit risk of vaccines that generates real-life data combining information from different stakeholders. Another challenge to overcome is the current fragmented landscape to monitor the benefit risk of vaccines at regional, national, and EU level, and to allow large-scale population databases which could enhance vaccine confidence. For vaccines manufacturers, monitoring and detection of all safety-related events is our top priority. Once a vaccine has been launched and marketed, it is often used in large scale at a population level, such as within a national immunization program. If there was a safety concern, there is a need to provide a robust and reliable answer in a short time period, to make an evidence-based decision and to communicate transparently and timely any decision to the general public, to ensure the appropriate public health intervention and maintain the public and healthcare providers' trust of vaccination.
In ADVANCE, we try to build a system that will provide quantitative information on vaccines coverage, benefits, and risk in Europe, pooling data from multiple countries and multiple data sources. What do you think the system that we built in ADVANCE, whether that will be useful for your commitments and effective communications?
As vaccines manufacturers, we really welcome the ADVANCE commitment and their outcomes. Not only the readiness in data and system, but also the readiness in human capacity is a great asset of ADVANCE. We can only build vaccine confidence by working together. Those post-marketing studies will contribute to enhancing vaccine confidence, which has been identified by the European Commission as one of the underlying causes of vaccine hesitancy, leading to a decline in vaccine coverage rates, which in turn has caused outbreaks of vaccine-preventable diseases, with unnecessary death and hospitalizations.
Why did IMI provide support to build a system for monitoring the effect, benefits, and risk of vaccines?
Well, you know, this question of the risk-benefit balance of vaccine is extremely important, both for our governments, or societies, for citizens, and obviously for industry, especially vaccine manufacturers. So it was obviously an ideal topic for a public-private partnership. Ideal topic, but very sensitive topic, because obviously to bring together the industry, the citizens, and those in charge of ensuring the safety and the regulatory approval of new medicine, that was a real challenge. And I must say that it took us some time to convince all stakeholders to come together and start this project, but eventually we succeed after sometimes difficult negotiations.
So in IMI, as you state, public and private companies are working together. So why do you think it's so relevant that the private companies participate, and especially with the public organizations?
Well, that's a very good question. And actually, many people remain reluctant to see industry involved in this discussion. Obviously, industry has its known interest that we know very well. But at the end of the day, industry is at the source of innovation. Industry is responsible for making existing and new vaccines accessible. So there is no point to keep industry completely out of the conversation. The challenge is to make industry accepting that for such a delicate debate, it's important that industry accepted that the lead of this type of project should not be in the hands of industry. You know, industry, usually they want to control as much as possible the process in which they are engaged. In this case, and this was rather unique in IMI, industry understood that in the interest of each stakeholders, it was much better to agree to give the lead to other parties, and also for industry, I would say, to keep a careful profile, so to make sure that what will come out of the project can be acceptable by those for who all these efforts is made. It was a challenge, it is still a challenge, but as I often said, the problem is not necessarily, to have industry involved. The issue and the question is to make sure that industry, I would say, stays in its role, and indeed that on the other side, the public actors organize themselves in order to be able to negotiate in good relation, but also with strong defense of public interest with industry.
I know you're not at IMI anymore, but how do you see the results and success of the ADVANCE project and its potential future?
Well, I would say that, the success is already to the fact that all these stakeholders succeed to work together to produce joint papers together during these years. And I think now we are at a critical step where the question is how to translate the output of this project into concrete measures that can be explained to citizens. We are not there yet. I still see some reluctance from different sides, which we can understand. And I think that now, for me, it's on the political agenda. And I really hope that some of the politicians in different European countries who are responsible for implementing vaccine strategies, who are responsible for making sure that vaccine coverage should be is what it should be, that they will take advantage of the output of this public-private partnership. It is a challenge, but for me, the challenge is even wider when you see the situation not only with measles, which is very often quoted in the media, but I'm also thinking about the HPV vaccine. I mean, it's now very clear that this vaccine is efficient, that it provides health protection, but still in some countries and in some regions, for example, in my own country, in Belgium, there is still a lot to be done. And I think that to make the situation better, trust is obviously essential. And to build trust means that we have to have in place good strategies about the way we assess risk and benefits.
Why did IMI provide support to build a system for monitoring the benefits and risks of vaccines?
Well, the topic really lends itself to a public-private partnership because the area, as you know, is a very controversial one and one where we need to build trust in the evidence that we create together. And it cannot come from just one voice, whether that be the public side or through academic research or indeed through the pharmaceutical sector. So it really lent itself. It's, as with all IMI projects, it relates to a big challenge for society where we believe a public-private partnership can be the engine with which we can address these.
Could you explain us why, particularly in this area of vaccine benefit risk monitoring, it's important that the public and the private companies work together?
Yes, well, the topic really lends itself because we are going through a little bit of a crisis in terms of the vaccine hesitancy movement and the anti-vaccine lobbies, which are very strong, I would say, especially in certain European countries. And so we need to rebuild trust. And the only way we can do that, I believe, is being very transparent in terms of how we work and also build the credibility of the evidence base that we would use. And this is, I think, the key to why a platform like IMI can be used to bring all those stakeholders. So it's not just the voice of pharmaceutical companies, it's not just the voice of some academic groups, but it's everyone together, including the regulators and other agencies, where the credibility of the evidence base that we would build through such a project would be such that we can rebuild that trust with the general public.
So how, as IMI director, do you see the results and success of the ADVANCE project?
Well, I think ADVANCE has been a super project, very productive. You can see with the documents that have been produced in terms of code of conduct and so on and so forth. But it has really, I think the major contribution has been to change the dialogue, to change the ecosystem in which we work, and where we do have this now multi-stakeholder credible voice being projected and building trust with the different communities and the public at large. So I think the communication part now will be absolutely key in terms of us being able to articulate not only the value of such a project, but articulate the value of vaccines to the community. And we know that the anti-vaccine lobby, as I was saying, is a very powerful voice. We need to have as powerful a voice on the the plus side of the vaccine debate. And we have there's a lot of evidence there. We know that vaccines are one of the best cost-effective public health measures that we've ever had. But we need to articulate that in a way that the public understands, that healthcare providers understand, so that they can communicate with the patients, the people who come in to get vaccinated, and recreate that trust.
How do you think such information should be best made available to the citizens?
This topic has recently entered in pre-electoral debate in some states and countries, for instance in mine, Italy. With the risk of being exploited politically, it's good to be better informed also in view of the next election of the European Parliament next May. We would like to avoid the issues of vaccination and immunization being exploited during the next European election, but instead, if necessary, to be addressed from a scientific rather than a political perspective. As a member of the ECDC advisory group dealing with vaccine coverage, we feel a great responsibility in committing ourselves to these issues and to properly inform the citizens. Likewise, the same responsibility should be felt by those who have produced evidence on the risk and benefit of vaccination, as the ones who have realized the advanced project, for instance. On the one hand, it's fundamental to use a friendly and simple language tailored to specific target. I can imagine young people, elderly, also the media. On the other hand, you need to identify strategies that allow you to reach the greatest number of European citizens. You could do this by involving the media and directly engaging with the citizens. Have you ever considered organizing a tour across Europe? We have done this in Italy, organizing a so-called open day in many cities, in 37 cities of 11 Italian regions. Our local offices were opened to give information of vaccine and help citizens face any critical issues in this area. Activists, together with experts, this is important, met citizens to promote proximity information, distributing useful materials and collecting reports in order to offer tools and support to protect them. Are you willing to come with us to meet the citizens in person and give them the right information? We expect you to do the same, and of course we are willing to cooperate with you.
How, as a citizen, do you view the collaboration that Advance has set up between the stakeholders, such as the public and the private and the regulators and researchers?
Yes, giving answers to doubts and countering vaccine hesitancy is more than right, but doing so without considering that they may be allies within the society would be a serious mistake. We strongly believe that there is a clear add value to the strengthened cooperation among all relevant relevant actors across Europe, including health authorities, vaccine industry, research, as you said, the healthcare sector, but we need to guarantee the involvement of the civil society and advocacy group. With regards to collaboration that Advance has set up, I think that has been necessary and welcome, of course. I don't know if it is complete, because probably there is a lack of representative of the civil society. As the Innovative Medicine Initiative is also supported by public funds, we expect that you cover adequately the dissemination of the results among the citizens. Please keep in mind that we have led the European Commission to extend the Coalition for Vaccination not only to the European associations of healthcare workers and relevant students' associations in the field, but also to the representative of the civil society engaged in the topic. Indeed, next March 4th, we will take part in the first meeting of this coalition, and I hope there is still time for you to do the same.
Thank you very much, Mariano.
You're welcome.